Well, hey, welcome back. It's Dan McDonald. Thank you so much for tuning in this morning. During the coronavirus pandemic, we understand that many people and their families are experiencing a high degree of anxiety and distress, both for frontline workers and so many of us who are working at home for the first times. We just opened an urgent mental health care center in Windsor. It's an issue. Dr. Jeffrey Casanova is co-founder of Therapy West. You can visit them online, therapywest.com. A unique clinical mental health practice that specializes in cognitive behavior therapy in New York City. Dr. Casanova is also a New York-based psychologist, marriage and family therapist, mental health counselor, and a school psychologist in New York State, and is joining me on the phone. Good morning, Dr. Casanova.
Good morning. Thanks for having me on the show.
Absolutely. Now, working from home, I'm hearing about the toll it's taking on mental health. Why does it take such a toll on us working from home?
I think it is, what I kind of coin it a Groundhog Sunday, in that we're sort of wearing our PJs and we don't have the same structure that we typically have had in the past. So when normally we would get up and go to work, or our kids would go to school and we'd have this normal routine, we're out of sync. And I think it's causing us to have a lot of emotional distress and increasing the likelihood for mental health issues.
Are we just designed, obviously we're all designed differently, but some people really thrive working from home and others kind of fall apart. They just don't adapt to it as well. Why is that?
Certainly everybody's a little bit different. I think, in general, I think most people are struggling with this new experience from working from home. And really, we're wearing many different hats that we typically don't have to when we're at work. When we're at work, we have a certain position. And when we're home, we're moms and dads and brothers and sisters. And now we have to wear all these hats at once. And I think we're getting pulled a lot. So I think for the vast majority, it's pretty challenging. For some of us, we're able to cope with that and handle it in a much different way. But I would say for the vast majority, this is a new experience and challenging to wear all those different hats.
One of those things, too, with drawing the lines with family limits, importance of workspace, keeping your spouse, your kids from coming into a room that's designated as your office or your workspace. Maybe they're used to going in there all the time. The basement is playroom, but now it's mom or dad's workspace. How important is that to kind of keep that structure and keep the family out of your workspace?
So I think that's essential, and certainly what we tell our clients and are telling as many people as we can, that structure is key in this situation. And we need to, I think some of the benefits is that we have the opportunity to create the structure when we have family time and when it's work time, and keeping our offices our own, and certainly indicating to our families when our work hours are kind of beginning and ending. And even for our own mental health, I think it's hard for all of us because we can easily go back and work constantly and not get away from it because of where we are currently today. So that structure is absolutely essential for our mental health.
Anxiety and depression, too. Where is that line? I imagine it's normal to have some level of both during these times when we're facing so much uncertainty. But where is the line when it crosses over from normal reaction to what we're experiencing to now this is a problem?
So we're in a trauma kind of state right now where everybody's going through this together. The fact that we're going through it all together is somewhat normal, right? So the first 2 weeks of this experience, I think we're in maybe week 4.5 or week 5 at this point across the nation. But the first 2 weeks, we sort of expect this experience where we're going to be sleeping too much or eating some bad foods and kind of breaking down a little bit. But our thoughts are that after about 2 or 2.5 weeks, we should be getting into sort of a normal routine and constantly tweaking it. So, but there are definitely signs that we need to look out for, such as low mood, maybe some cognitive or mental mistakes, some weight loss or weight gain, and any changes in affect we want to look out for.
Do you think, too, in this time, and this is a tough one for a lot of people, especially depending on your work, but people who aren't used to working independently or from their homes, should our employers be cutting us a bit of slack or taking that into account that working from home is something many of us have never done before if our productivity level isn't what it is when we're in the workplace?
I certainly hope that every employer is giving people some slack. We certainly need it, especially with all this stress that's around us. If we put on too much pressure, that can increase, the likelihood for a mental health issue. And certainly we don't want to see our staff and other human beings on the earth kind of break down while we're going through this crisis. So I think it's important to give some latitude, and I think it's really important to give a lot of training and support. Some of the things that we do, amongst our colleagues is we have, Zoom chats where we're communicating not about work, just about trying to connect with each other in a more normal way as we would if it was, quote unquote, by the water cooler. So it's very important that we do those things and give people a little bit of latitude.
It's true. That's something we don't always take into account. For a lot of people, a lot of us, our work is, for some, our only social outlet. So that being cut off is a big shock as well.
It is, and I think that there's this balance that I hope that we're all finding where we're using Zoom calls and connecting and doing it, whether it's a happy hour, sort of virtual happy hour that some people are doing, or connecting with grandparents, et cetera, and certainly other colleagues and family. But we also need to realize that's kind of invading our homes. So, I can walk into my son's room and he's on a Zoom call or doing stuff, and I typically wouldn't have expected that 2 months ago. So there has to also be a balance of when we shut off that as well. So it's, I think we're all learning as Americans sort of where that balance, where the right fit.
One more question for you, too. One thing I always hear is the importance of shutting off work mode. Not all of us have the luxury of doing that, but since we are at home and those work-home lines are blurred, it's so important we do put our foot down and make sure our employers know that we're not on call 24/7. It probably is a bit difficult for some people to be assertive in that way.
I think it is. I certainly hope that for employees that they can develop those assertiveness skills and have the right manager that they can lean on a little bit about those things, because that's really an HR or a human resource issue where they need to say, listen, I understand I'm home, but, it's Friday at 7:00 and I need a break. It's my weekend. And I think we all need that. And that includes, the bosses and the managers to find that time to have breaks, to have a lunch hour. I know that I struggle with that because, I think all of us do. We want to work hard and do well, and we need to take those breaks. So the most important thing is to communicate, right? And that we all understand that we all have needs during this tough time, and to work collaboratively so we all find the right fit.
Absolutely. Well, hey, TGIF, Dr. Jeffrey Casanova, co-founder of Therapy West out of the west side of Manhattan, therapywest.com. A lot of great info on the website and today. See, I got that. I knew it wasn't California. I knew it was the west side of Manhattan. Appreciate you hanging out for sure. I appreciate you chatting with us today.
Sure. I just want to let everybody know that we are doing virtual therapy across the nation. So if anybody needs any help or support, please feel free to reach out to us. We have a lot of wonderful clinicians that work at Therapy West, and they can just go to our website, which is therapywest.com.